Hi, I'm Dr. Alan Abando, and I'm a board-certified general surgeon. I'm here to talk to you about bariatric surgery and its effects on weight and wellness. What happens with a lot of patients, and people in general, really, is that as you age, you lose muscle mass. So as you lose muscle mass, you can lose metabolism. That's why regular exercise, very important to maintaining a good, healthy weight. So as you age, your metabolism also might slow for whatever reason. Excess calories, so on. There's also other factors. It's very complicated when it comes to weight because there could be emotional eating, stress eating that causes you to gain weight. And so as you keep gaining that weight, you throw in their genetics, which 70% of obesity in patients is from genetics. And so you see it in a generational way where you see, oh, grandma, mom, sister, and then your kid, and you see it generationally that obesity, once it gets activated, it's almost like obesity starts to become a norm. And so as you get bigger, your body tends to set a set point higher each time. So your body gets used to being 50 pounds overweight. And then when you try to lose some weight, your body's like, whoa, wait a second. I actually think 50 pounds overweight is where you should be. I think that's your normal. So your body will literally slow down your metabolism, decrease thyroid hormone production, to cause you to try and go back to that 50 pounds overweight. The problem is that when that metabolism drops and then you can't lose any more weight, the first 20 or 30 pounds you're doing great and then you hit a brick wall. Then the next thing happens is you're like, I'm doing everything the same, I'm not getting anywhere. Forget it. And many people give up. And the next thing you know, they gained the 30 they lost, but then some. Because remember, the metabolism had tried to slow down to get you back. So a lot of people, I'll just eat the way I was before, I'll be fine. Problem is, if you eat the way you were before with a slower metabolism, now you're gonna gain. So you lose 30, you're up 35. You lose another 30, you're up another 35. So after 60 pounds of weight loss, you're up 10. And that's the frustration, is that it just keeps going up. Then the set point gets set again. Now, we always talk about it as metabolic adaptation. It's the body adapting to the fact that it thinks that your set point should be at a certain number. What's beautiful about bariatric surgery and weight loss surgery is that, and our dietitian helped in looking into this because she did her master's in dietary, and one of the projects she looked at was what happens to that metabolic adaptation in bariatric surgery patients after they've had the surgery. At about 12 to 18 months, that metabolic adaptation goes away for a short time. So it's almost like patients get a chance for Control-Alt-Delete of their set point. So they're no longer saying, oh, I'm 300 pounds. Your body's like, okay, well, where are you at right now? And then you get to reset yourself down to, let's say you were 300 pounds, now you're 180. So now after that reset, your body has had a chance now to say, I'm gonna be at 180, and now you get to fluctuate. Instead of around the 300 pounds, you're fluctuating more around the 180. So that's what's so beautiful about bariatric surgery, is it gives people that opportunity. Now, is it a guarantee? No, by any means, it's not a guarantee. But that's why we always tell people to work at it as hard as you can in that first year, because you're gonna give yourself that opportunity, so you go for it. You go for it as hard as you can, so you can get down as low as you can, so you have that wiggle room. But that's the beauty of the way surgery has helped a lot of people, is that it gives you a chance to really change your metabolism, which is why our society is metabolic and bariatric surgery. If you want to learn more about how bariatric surgery affects weight and wellness, please visit our website.